So tonight's subject is going to be on somatic education. Now, what is somatic education? Right, there's some people joining me today already. Good to see you. I won't say name, but you know who you are. If you have a question for me, put it in the comments box. Maybe I'll answer it during the live stream for a change. I'm just learning how to do this as we go along. But yeah, get a question in there. So the subject matter is somatic education. Now, this was something I was introduced to, maybe about 3 months ago. And I had a wonderful conversation that led to a podcast interview on somatic-based training. Somatic means body, or soma means body. And it's a way of training the body to help reduce pain and to help the brain transform. Now, from that podcast interview, I went on to have a workshop with one of my now new friends, Teresa Ojinma. She's a wonderful lady. She's a kinesiologist, exercise therapist, and now she's officially certified in somatic-based education. So I did it for a group workshop, and then I went for an individual session just 2 weeks ago. And I was just learning more about this. And I'm just going to share a tip from that I think can be easily introduced. And this week, I've been informing patients. In fact, one of my patients is on here tonight. I was talking to her this afternoon about it. So she's got a bit of a headway. But I'm going to be sharing an exercise technique that really enhances the mind-body-brain connection. And one thing I learned from this training, it's rooted in multiple individuals like Alexander. He was a physiotherapist in Australia about 100 years ago, I believe, who developed that very familiar position type therapy for low back pain and herniated discs, where you lie on your stomach and you do a cobra position where your back goes up 30 or 45 degrees, and therefore you can enhance that back pain treatment. So another guy called William Hanna, who again took on the information and ran with it. And before him was Feldenkrais, who's a gentleman from Israel who developed a exercise-based type treatment that I've known about for quite a while. So anyway, accumulation of all these techniques leads to an awareness, and it's simply this. And one, there's 3 steps to the somatic-based education. You can do this in any part of the body. All you need to do is move a part of the body and then contract the muscle involved in that movement, and then you relax that muscle, so you take the movement back to neutral, and I'll demonstrate in a minute. And then the third phase is a relaxation phase, where you just pause, you have a deep, slow breath, and you just are aware of the muscle you've just moved. So in this technique, you're literally just connecting the brain with that muscle, and then with contracting, you're increasing that awareness, that neural connection from the brain down to the muscle. And as you slowly release it in a slow rhythmic manner, you don't want sort of a jerking action. You want a slow, steady movement, which may take some time to perfect. And then again, you're increasing that awareness from the brain to the muscle, and the muscle back to the brain. And then the third phase, you're just pausing for maybe 5 seconds or more, just a deep, slow breath in through the nose and then out through the mouth, while you pay attention with focused mindfulness on the muscle. So with that, you are bringing in the whole concept of mindfulness, movement, and breath, which I think are 3 fundamental aspects to healing the brain-body connection with chronic pain. So somatic-based treatment. One patient I was actually just talking to this afternoon, he's coming back to see me probably tomorrow morning, and he introduced me. This gentleman had lots of chronic pain from a severe MBA, and he had amazing results from Teresa with somatic-based education. Then he came to me, I did my trigger point injections, and a combination of both were the 2 treatments that changed his life, and he's now moving forward. And that's how I got introduced to it for the first time about maybe 4 or 5 months ago. So anyway, let's demonstrate. I'm going to turn my head to this direction, and I'm going to basically contract the trapezius muscle here, like this. So I'm going to turn, in fact, no, I'm going to elevate the shoulder instead. That's a little bit easier. So I'm going to elevate the shoulder, and you can see my trapezius is going to go up. So I'm going to talk my way through it so you get an idea. Maybe if you can join me if you're safe, you're at home, you're in a comfortable position, you can do the same. And then I'll give you some tips on how to introduce this more in a regular practice afterwards. So here we go. So we're going to elevate the shoulder, and you're going to just tighten up the muscle so you're contracting it. You should feel the muscle just tightening up, like squishing towards your ear from the shoulder. So I'm just aware of it. I'm thinking about it right now. I feel it. It's like a tension build up. And then I'm going to slowly relax. Now look how slow this is. It's a little bit jerky. And it's coming down. There you go. So now slow relaxation with focused attention. And then the next phase, just going to breathe in. Think about the muscle. Into the nose, count to 5, out through the mouth. So if I'm honest, I wasn't focusing on my shoulder. I was focusing on my hand for the camera, but I hope you got that. So basically slow in through the nose, out through the mouth, focusing on the muscle. So what you've done there is you've brought a state of amnesia, which is like forgetfulness or lack of memory, that's basically occurring when we've got pain, because there's no real functional connections going on where we've got the spasming pain or severe pain or contraction of pain. But if you tighten the muscle, relax it slowly, and then count to 5 in and out, and then just be aware of it, you're increasing the awareness to that muscle. So if you've got the shoulder, say, you could go up and then down motion, forward and back motion. You could repeat on the other side. For your neck, just rotate to one side, rotate to the other side, and then you could look down to one foot, the other foot, and then maybe slightly straight down between your feet, and then slightly up. I would recommend going too far up, maybe 45 degrees up for the neck. And just be aware of which muscles are moving. You don't need to know the name, just roughly where you're feeling the tightness or the contraction. And you can start an exercise there. Now, you can work around the whole body. You know, if you've got calf pain, you just bend your foot towards yourself or towards the leg for the calf and stretch, and then point the toes away from your leg. That will be a calf contraction. So you'll be contracting it first and then relaxing it, and then just pausing and being aware of the calf muscle. So I encourage you to maybe use that. Give me some feedback. Give me some comments. Did it work for you? If you want some more information, Teresa's website's wonderful. You can look her up on Google. It's Teresa Ojinma, so Tersa space Ojinma. Teresa Jinma, Somatic Based Treatment, BC, and she's available for classes in South Surrey and in Morgan Creek there. So, maybe if you're out of town, you don't live near Vancouver, maybe you can go to your local somatic-based educator. And it's interesting the word they use, educator. They don't use therapist, although you can be a physiotherapist or massage therapist and integrate this into your practice. But in the first levels of education or certification on the subject, it's education, because we're educating people about this. And it's up to the person and the patient to practice and learn about the body. And I think the wonderful thing that I got from just walking around the room after doing some sessions with Teresa was just you became aware of your body. Like the foot, moves forward on one leg, and your heel goes down, and then your forefoot goes down, and then you swing your hip, and then your next foot goes down, heel down, forefoot down. And you're all of a sudden becoming aware of what we're doing. And we do probably thousands and thousands of little movements all the time in our body. When you think of this movement here and how simple that is, well, what about the hand? What about the arm? What about the wrist? What about giving a good old jiggle and a dance? How many movements are going in? And we're actually aware from here down to our body. So this is the wonderful thing of somatics that I love, that I encourage my patients to do, especially if they've got tight contracted muscles and they maybe can't go for walks or they can't do too much. A wonderful based exercise. Anyway, I've enjoyed this show tonight, this live stream. I hope you've enjoyed it too. I'm just going to wrap up now. If you've got any medical concerns about your pain or health, see your healthcare provider, family physician, nurse practitioner, or whoever you may be seeing at the present moment. This is purely for education, and I hope you find this is helpful. Thank you for joining me. Thank you for staying on, and I look forward to next week, where I'll conjure up another topic to talk about chronic pain and how it can help you move forward in your life. So, bow out now. Thank you so much. Have a great day and all the best.